If you have back pain, once you are ready to start rehab, what will usually help is beginning with an extension program. Note the word usually. This is not good for everyone, but in my experience, about 80% of patients, once we start on an extension program, which means arching back movements, are really beneficial. The first part of this extension program is just lying propped on your elbows. So you can lie down on the floor, just propped up on your elbows. Now early on, you might not be able to get right up, and you'll just start not forcing things too much. And the usual timing is 10 to 20 minutes. And you can have ice, a bag of ice on your back, large bag of frozen peas wrapped in a damp tea towel. And if you want, you can get yourself a cushion from the sofa or a pillow and just prop yourself on that to take some pressure off your shoulders. And that's not usually a comfortable position. And hopefully you'll feel better after. If you feel worse after this, then you stop doing it and it's not appropriate for you. The next stage in this program is an active press up rather than just a passive propping. So place your hands out as though you're going to do a press up. It's not a press up to strengthen your arms, but just press up, keeping the hips down, hold, count 1, 2, and down. Press up early on, you might only be able to do 3 or 4, but work up to 10 repetitions. And it's not uncommon for us to suggest if you're in really acute back pain to do this 2 hourly through the day. So it's quite regular. And if it's one of the few things that's helping your pain, you'll actually be looking forward to doing this. And the aim is for you to feel looser afterwards. So after the propping and the press-ups, the next stage is an exercise where you're doing just a gentle rotation. So lying flat on your back, get yourself comfortable, bend the knees up, and just gently rock over. Note that foot's off the bench. So we're not struggling, just let your body be loose. That right foot there, that comes off the bench. Just rolling, you can see the back rotate, that shoulder's staying on the ground. And you'll do 5 to 10 rotations each way in just like a nice slow rhythm. So after you've finished the rotations, just draw one knee to your chest gently, and then the other knee to the chest, and then just try to grip with both hands and just gently pull in. In that position, I'm feeling a stretch right just on the belt line here in my low back, and that should just feel as though it's giving some sense of relief. Quite often, if this is the exercise that helps you the most, then we'll progress on to what's called child's pose in yoga, and we'll do that quite early. So if this position is giving you lots of relief, child's pose, which is a pose that a lot of people know by name, just with the feet flat on the floor, kneeling down. Obviously you can't do this if you've got a knee problem, and just bring the head forwards and just relax in this position. And quite often we'll prescribe this for 2 minutes, 2 to 3 times a day. Now for quite a lot of people this will aggravate, but if the other exercise helps, then this is probably going to ease things. It doesn't matter if your arms are back or forwards. So there we have it. In the early stages, what we like to start people on seeing which exercises help, including the propping with or without ice, with or without using a cushion to prop over, press-ups, keeping the hips down, lying on your back, gentle rotation side to side, pulling your knees into your chest, and if that's helping, then add child's pose for up to 2 minutes as a regular daily program.